potential game changer in getting people vaccinated. By the end of the week, millions more Americans could be eligible for a COVID vaccine booster. Both the FDA and CDC separately will talk about extra shots this week. Channel 2 Steve Gelbach is live outside CDC headquarters in DeKalb County. Steve, one thing they're looking at is whether mixing up the shots would be a good idea.
And according to the New York Times, the Food and Drug Administration, they are going to approve this week, allowing people to get a different COVID-19 vaccine as a booster instead of the one that they got originally. And then the CDC, they're going to meet the next day here on Thursday, also discussing vaccines and boosters and make their own recommendation. With the Pfizer vaccine booster already approved, the FDA is expected to authorize boosters of Moderna and Johnson & Johnson vaccines by late Wednesday.
They're ready to give me a booster. I'll roll up my sleeve, ready to take it.
Stephanie Twitty Carmen got the Johnson & Johnson shot last November as part of a local vaccine trial. She's now preparing for a booster once approved.
3 days, my arm was very sore, and that is the only thing that I experienced.
The current recommendations are a booster for anyone age 65 and older, a healthcare worker, or in a high-risk group. But that is expected to expand to anyone 18 and older who had the one-shot J&J vaccine. Dr. Jane Morgan, executive director of the COVID Task Force for Piedmont Healthcare, says a recent study, even with a small sample, showed getting a different vaccine booster may give the most protection.
Data that is out now does show that it is safe to mix and match these vaccines. They looked at 458 people, all of whom had received Johnson & Johnson, Moderna, and Pfizer, and then gave each of them each of the other 3 vaccines and measured those responses.
And when you look at the results of that study, it showed that Moderna gave the biggest boost, followed by Pfizer, then Johnson & Johnson last. Now, there will also be another meeting of the FDA a week from today. We'll be watching that closely as they're going to talk about the efficacy and the emergency authorization for children ages 5 to 11. So we'll be watching what happens again this week and next week with these meetings and those recommendations that are now changing very, very soon.
And these boards don't always do exactly what people expect them to do, so it'll be interesting to get their results, and people can talk to their own doctor to make their own decisions. Steve, thank you. Well,